Fungi, commonly known as mold, are eukaryotic organisms capable of growing on various surfaces when proper moisture, temperature, and food are present. When preventing mold growth, moisture is the most critical element to control. There are over 70,000 species of mold, and its origins date back to the early stages of life on our planet. Mold spores can survive dormant for centuries, remaining inactive until the environmental conditions allow for growth. These organisms belong to the fungi kingdom, and they may or may not be beneficial to humans, acting as a food ingredient or as a poison, depending on the species and the individual's susceptibility. According to the U.S. Center for Disease Control, certain individuals are more sensitive than others to mold when exposed to it, experiencing symptoms such as nasal congestion, eye irritation, or coughing. Others may experience severe allergies and develop fever and difficulties breathing. People with chronic illnesses such as obstructive lung disease or immunocompromised persons can develop respiratory infections when exposed to mold. In 2004, studies conducted by the Institute of Medicine found sufficient evidence to associate exposure to mold in indoor environments to symptoms of illnesses in the upper respiratory systems in healthy individuals. The studies also found that the same conditions triggered asthma symptoms in asthmatic persons and in those with hypersensitivity pneumonitis in immunocompromised individuals. Since the earliest days, mold contamination has been a problem for humans, having caused illnesses and suffering to the occupants of indoor spaces. While faced with the challenges of not being able to see the spores in the air. One of the earliest human records regarding mold contamination is found in the Bible. A passage found in Leviticus 13 says, "As for any fabric that is spoiled with a defiling mold, any woolen or linen clothing, any woven or knitted material of linen or wool, any leather, or anything made of leather, if the affected area in the fabric is greenish or reddish, it is a defiling mold. It must be shown to the priest. The priest is to examine the affected areas and isolate the article for 7 days. On the 7th day he is to examine it, and if the mold is spread to the fabric, the woven or knitted material, it is a persistent defiling mold. The article is unclean. He must burn the fabric, the woven or knitted material. But if when the priest examines it, the mold has not spread in the fabric, the woven or knitted material, he shall order that the spoiled article be washed. After the article has been washed, the priest is to examine it again, and if the mold has not changed its appearance, burn it. If, when the priest examines it, any fabric, woven or knitted material, or any leather article that has been washed and is rid of the mold must be washed again, then it will be clean." With the resources available today, there are efficient methods to control mold in indoor spaces. Considering the potential adverse health effects and discomfort caused by mold, coupled with building and content damages, any presence of mold contamination must be evaluated and remedied, and the root cause of such moisture investigated and brought under control. A clear example of the worldwide efforts to prevent mold contamination and achieve healthy indoor environments can be found in the numerous requirements and credit points of the USGBC LEED certification program. If mold growth is not under control, the certification is not likely achieved, therefore preventing unhealthy buildings from being occupied. For example, credit 1.1 of Indoor Environmental Quality for LEED for existing buildings provides a credit to those that improve indoor air quality practices. These procedures are aimed at preventing risks associated with exposure to contaminants, including mold. Also, regarding indoor environmental quality, credit 3.1 for new construction requires the implementation of measures to prevent mold growth, while also promoting the use of mold-resistant materials. LEED for Homes emphasizes prevention as a key to prevent mold growth, allocating a credit in innovation and design for the use of materials capable of inhibiting mold growth, while credit 3 of the same category refers specifically to the need to control airborne mold spores to provide comfort, reduce risks, and ensure the durability of buildings. Credit 5 also refers to local ventilation in critical areas such as bathrooms to prevent mold growth. Additionally, LEED for Healthcare Centers establishes in mandatory format the removal or encapsulation of contaminants, including mold, while Credit 3.1 requires the need for a mold prevention program, keeping materials dry and in good condition. CIH Environmental Solutions assists property owners, managers, and tenants to resolve challenges relating to mold contamination by conducting state-of-the-art property assessments. When needed, clear and solution-oriented remediation protocols are prepared following state regulations and applicable guidelines, such as the widely accepted New York City Department of Health Mold Guidelines. In 1993, this government agency drafted the first guide that sets the gold standard of today's mold prevention practices by providing tools to evaluate, control, and mitigate a toxic mold known as Stachybotrys chartatum. As a result of its acceptance and wide use among the medical, legal, environmental, and real estate industries, the guide was later expanded to all species of mold. As a result of his extensive career in environmental and occupational health, Armando Chamorro, board-certified industrial hygienist and president of CIH Environmental Solutions, was called on to assist in the revision of the initial version. CIH takes into consideration the New York City document to provide assistance to customers facing mold-related challenges, with strategies divided into 3 important phases, encompassing initial building evaluations, monitoring during remediation, and pre-occupancy surveys. Initial evaluation phase. From the indoor air quality perspective, one of the most important ways to have a healthy and market-valuable property is to prevent mold colonization by monitoring the site conditions, conducting third-party professional assessments of the occupied areas, building envelope, and air conditioning systems. The surveys can be done in a proactive manner, such as in the case of semi-annual proactive mold evaluations or due to specific concerns where there is a necessity to determine acceptable conditions. These evaluations require visual inspections and are often supplemented by air and surface sampling. Useful measurements of temperature, relative humidity, and surface moisture are routinely included. When mold air samples are collected, the specimens are sent to an MPAP participant laboratory that ensures proper mold sample preparation. Analysis and reporting are conducted following rigorous quality control protocols. The result of all field and laboratory data may indicate that conditions are acceptable, requiring no further actions. At times, this evaluation may indicate the need to adjust humidity control settings, repair a recurrent leak, or to conduct mold abatement of the affected area, in which case a remediation protocol is formulated. Small remediation projects may be conducted by trained in-house maintenance personnel, or may require engaging a state-licensed mold abatement contractor. CIH reports are routinely used by attorneys, insurance adjusters, property owners, and physicians to judge patients' indoor air quality conditions. CIH technical reports often include detailed information with photographs and graphs that illustrate the findings. Tasks during remediation. CIH professionals act as third-party verification during mold remediation activities, making sure that the contractor complies with the abatement protocol while providing guidance when unexpected environmental conditions occur, such as the discovery of hidden mold in the cavities beyond the original scope of work. This verification serves as an independent proof of additional work needed. During the initial phases of the remediation process, the integrity of the isolation area is verified, along with equipment air filtration scrubbers and pressure conditioners inside the abatement area. Documentation of proper practices is also secured with photographs and by monitoring the air quality in occupied areas adjacent to the remediation. Proper debris disposal procedures are also documented. Tasks conducted upon completion of remediation. Upon completion of all mold contamination and subsequent cleaning of surfaces, CIH professionals evaluate the abated area by conducting a visual and borescopic inspection, along with air and surface sampling. Similarly to the initial assessment, samples are immediately submitted by expedited analysis to assess if the areas are fitted for reconstruction and subsequent reoccupancy or reuse. Mold has grown in indoor environments for thousands of years, particularly when moisture conditions are not under control, causing potential damages to occupants and buildings, even when not visible to the naked eye. CIH provides licensed professionals, state-of-the-art equipment, and an in-house 24/7 microbiology laboratory to provide support whether a LEED certification is desired or initial site evaluation is warranted due to mold concerns. The CIH team prepares technical and solution-oriented mold abatement protocols, and when removal is needed, it's integrated monitoring approach followed by pre-occupancy inspections, ensuring that the remedied areas are restored to healthy and safe conditions.